So regarding fructose metabolism, fructose initially the enzyme is fructokinase. So fructose 1-phosphate and then aldolase B. So that is fructose 1,6-bisphosphate. The deficiency of fructokinase is essential fructosuria, which is asymptomatic, whereas aldolase B is hereditary fructose intolerance, which is symptomatic. So it accumulates fructose 1-phosphate when aldolase B is deficient. Epimer of glucose, remember the mnemonic is mega, mannose and galactose, that's C2 and C4 respectively. Then omega 6 and omega 3 is linoleic and linolenic fatty acid. Isolated decrease in DLCO, that is pulmonary artery hypertension, pseudo hypoparathyroidism and pseudo hypoparathyroidism. So in pseudo in both you get a knuckle dimple sign, and biochemical everything is normal in pseudo. In pseudo, whereas in pseudo what happens, the calcium is low, and usually PTH and phosphate is inverse relation. Here it is pseudo hypo-PTH, so it is not inverse relation. The PTH is high. Actually phosphate should be low, but since it is pseudo, phosphate is high. Sjogren syndrome increases the risk of marginal B-cell lymphoma. Then pioglitazone contraindication. So in Sjogren's it is mainly diffuse marginal B-cell lymphoma, especially maltoma, and it is involving CD4 T cells. Pioglitazone contraindication, there will be water retention, so contraindicated in cardiac failure, and the pioglitazone is causing bladder cancer, and they are hepatotoxic also. Hyperthyroid versus thyroid storm. In hyperthyroid you can give carbimazole or methimazole like that, first line, but thyroid storm mainly you have to give peripheral conversion inhibitor like propylthiouracil. Since carbimazole, methimazole do not having that action of peripheral conversion, you have to give propylthiouracil. Repetition is impaired in Wernicke's, Broca's and conduction aphasia. But if the question was transcortical sensory or motor, repetition will be normal. So it is impaired in this three. Or then which order neuron in thalamus? Thalamus is third. Cholera, it is cyclic AMP. Cyclic GMP, you have only one example, that is heat stable toxin of ETEC. Remember, if it was heat labile means it is in air. Cyclic AMPA, heat stable GMP. Ventilation perfusion ratio maximum at apex. Sucralfate, what is the side effect and what is the side effect of proton pump inhibitor? So proton pump inhibitor means it is not creating the acidic medium, so bacteria can grow. It can lead to impaired absorption of calcium, bone fracture. Vitamin B12 deficiency can be the megaloblastic anemia. QT prolongation drugs, remember in which antiarrhythmic drugs are included. So includes from 1A, quinidine procainamide, then comes 3 also, amiodarone, sotalol. Chloroquine resistant malaria. So there are other drugs in QT prolongation like antihistamines, cisapride, astamizole, terfenadine, like that. But in antiarrhythmics you have to remember 1A and 3. Chloroquine resistant malaria in pregnancy. Then actually in pregnancy you give chloroquine, but you do not give chloroquine, you can give quinine plus clindamycin. Then last to occur in rigor mortis. So we know it is in the order: first involuntary muscles, that is myocardium, then eyelids coming down, neck, then thorax, hand, that is arm, then abdomen, limbs, abdomen, then leg. So it is, remember, after abdomen, then you have to remember the hands, they are last. Upper limb is not, upper limb comes after thorax, but the extremities come last. Okay. Therapeutic privilege means that is about disclosing somebody's data, maybe to their relatives, like that. Acute radiation sickness, the values are very important in the order HGC, hematological, GIT, cardiovascular, 0.7, 10 and 100. Food inversion plus sensorium absent in dosum of food means, inversion means deep peroneal is gone, sensation gone means superficial also gone, therefore common peroneal nerve injury. Tail of pancreas in splenorenal ligament. Diffuse microcalcification, then simple mastectomy. Factitious disorder is to get medical attention, but if some other benefit, then malingering, maybe money, maybe to get a leave in working place, like that. Lucid interval is patient is responsible for the crime. That means lucid interval is not only in extradural hematoma, maybe in mania, some psychiatric disorder. So that lucid interval is the term given for that mentally sound condition between two unsound condition. That is the definition itself. So definitely they will be responsible. Arsenite is inhibiting glyceraldehyde 3-phosphate dehydrogenase. Arsenite is inhibiting in Krebs cyclitis A4A, alpha ketoglutarate dehydrogenase. Enzyme in irreversible phase of HMP shunt is G6PD deficiency. Just remember G6PD, once hemolysis you can't reverse, right? That's it. Which phospholipid seen only in mitochondria? Answer is cardiolipin. Mitochondria is the powerhouse energy source. So like that in our body, heart is very important, right? Cardio. So cardiolipin. Substance converting cisretinal to transretinal is rhodopsin. So cisretinal to transretinal, there is rhodopsin, then bath, lumi, metarhodopsin, and then transretinal. Perflation is actually natural ventilation. When you open the window, that is perflation. Direct contact means it can be skin or mucosa, it can be through soil, it can be sexual transmission or transplacental transmission, or it can be droplet transmission. Whereas droplet nuclei or fomite is indirect. Male health worker, what are the roles? L for leprosy, M for malaria, N is National TB Eliminate, RNTCP. N for National Blindness Program, R for RNTCP, that is TB. Then, so remember it includes TB, leprosy, malaria, blindness. S for sanitation. Then you have T, that is again TB, and E for expanded immunization program. If universal immunization is for female, male is more elaborate. So expanded immunization program. And also remember It was R में there is reproductive health like contraceptive supply and sanitation. Remember the chlorination of water also includes. Okay. So male health worker, the common work of male and female includes like keeping records, then regarding the food nutrition and regarding the contraceptives and some disease, communicable disease, then dots providing all this. Whereas this is specific for male health worker, leprosy, malaria, national health program, national blindness, then reproductive and child health, RCH, and also R for R and TCP. S for sanitation, including chlorination of water, TB. E for expanded immunization program. Nocardia means it is strict aerobic. It is in soil. It is staining two stains. One is gram stain, acid fast. Definitive host of babesiosis is tick. Listeria motility at 25 degrees Celsius. Beta 1,3 glucan test is Capus. Capus, remember it is candy, glucose, so candidiasis. Aspergillus and pneumocystis jirovecii pneumonia. EBA is epidermolysis bullosa acquisita. Collagen 7. Perthes is around less than 10 years. SCFE is like 10 to 13, that age group. Perthes associated with protein C, protein S deficiency and all. SCFE associated with hypothyroidism and in Perthes abduction and internal rotation is seen. CTEV management according to age. Remember Swan, Duet. Swan is soft tissue release. Evans procedure. Swan. Then Duet is Dwyer's osteotomy, Duet wedge tarsectomy and triple arthrodesis. Swan two words, Duet DWT 3 words. So in the order less than 3, 3 to 5, 5 to 8, 8 to 10 and more than 10. So that is on day 4 and stay tuned till then. Bye.